Welcome to our What's New and Optimized for 2024 webinar. We are ConnectureDRX, the market leader in Medicare shopping, enrollment, and retention technology. Today, we will be sharing information on the new features and digital tools for our Plan Compare One and Plan Compare Edge platforms. Plan Compare One is our platform for health plans and large FMOs and agencies. Plan Compare Edge, formerly known as Medicare Edge, is exclusively for small to mid-sized agencies. Our goal today is to ensure your agents offer an exceptional customer experience this AEP, stay connected to beneficiaries post-enrollment, and retain them as customers for life. When agents work on ConnectureDRX platforms, they benefit from the most extensive carrier network, the largest health plan, agency, agent, and provider distribution network, and the most accurate drug pricing in the industry. I'm Jason Schmidtkins, Director of Strategic Accounts with ConnectureDRX, and I'm thrilled to be presenting today with Brandon Manbeck, our Senior Director of Strategic Accounts. As you can see, we have a lot of digital tools that are important for agents to be aware of. We are presenting some of the key highlights in alphabetical order. Those in orange are new features for 2024, and many others have been optimized this year. We will move quickly, but we will emphasize the importance of each when working with beneficiaries. And now I'll turn things over to Brandon to get us started.
Agent call recording helps ensure an agent stays compliant when shopping, comparing plans, filling out scope of appointments, and completing enrollments. Agents working via laptop, tablet, or phone can see if a call is in progress in the upper corner of the platform. They can easily end the call with the click of a button as well. Recordings are stored on the platform for easy access at any time. ConnectureDRX platforms have dashboards to help agents manage their day-to-day tasks and their books of business. In addition to reports and training materials, which include flyers and videos, the dashboard houses enrollments, personalized quotes, and scope of appointments. In the section for notes and tasks, agents can also find relevant beneficiary profile information. The dashboards are very simple and streamlined to help keep agents organized. When searching for plans in a zip code, agents can choose to see only the plans they are licensed to sell or a listing of all available plans in the given area. They can also filter whether to include special needs plans in their results. Interestingly, as the fastest growing segment of Medicare, these SNP plans are now 19% of all total Medicare Advantage members, and 89% of these are dual eligibles. Recognizing the importance of these SNP plans, agents may also see additional messaging regarding dual eligibility when the member is flagged as being Medicaid eligible. Prescription drug coverage is often a critical component in the plan selection process for a member. As a reminder, a drug formulary is a list of generic and brand name prescription medications covered by a health insurance plan. Drug formularies vary from plan to plan, and if medications are not included in a plan's formulary, beneficiaries may be responsible for paying the full cost of the prescriptions out of pocket. To assist with lowering drug costs and medication adherence, Plan Compare One has a feature for finding alternatives to off-formulary drugs. If a prescription drug is not covered by a plan, agents can easily find available options that are covered by the plan. Agents are also able to select the condition a member uses a particular medication to treat, in order to help filter the list of alternatives displayed. As always, a member should confer with their physician before switching their medication.
We offer several different types of ancillary plans, including dental, vision, hearing, and hospital indemnity on our Plan Compare One platform. We also want to give a shout out to an important dental carrier on our platform and the benefits they are offering via MetLife. With hundreds of thousands of dental offices, NCD offers outstanding member care experience and has plans available for all budgets. Here you can see an overview of the benefits they offer, boasting the largest benefits offered in the dental market. We have several features related to prescriptions and pharmacies we will be calling out, and building a medicine cabinet is an important feature agents should take full advantage of. As an approved third-party user for Blue Button, ConnectureDRX is integrated with MyMedicare.gov to help streamline and simplify the medicine cabinet building process. Once authorized by the member, Plan Compare One will automatically synchronize with a member's MyMedicare account and download their latest prescriptions and load to their medicine cabinet. Of course, you can always enter prescriptions manually, but this tool helps ensure that a member's prescription list is up to date and accurate. Plus, it's a great time saver for everyone. Another new feature we are offering this year is the ability to select and price online digital pharmacies alongside traditional retail pharmacies. A digital pharmacy is an online pharmacy such as PillPack or Amazon that does not necessarily show up in a user's zip code. This feature allows the user to search for digital pharmacies no matter where they are physically located. An agent simply clicks on the Digital Pharmacies tab on the pharmacy page to see online pharmacy options to add to their profile. Once selected, plan coverage and drug pricing for these digital pharmacies will be displayed on the plan list page alongside other pharmacies. Health cost personalization is another way to help beneficiaries find the right plan for their circumstances. With this feature, agents can choose to either estimate costs based on a general age band and health profile, or customize their expected utilization of different health benefits offered by Medicare plans. Once inputted, estimated costs for different services, as well as an estimated annual total, will be available for each plan in a member's area. It is also possible to submit a health risk assessment at the time of enrollment or following an enrollment. HRAs are a great engagement and retention tool when done post-enrollment. Agents stay connected to the members during the pre-effective period, which is the time frame between enrollment and when benefits actually begin in the new year. Staying connected to members during this time helps retain them for life.
This is a great new tool for 2024, allowing agents to confirm a member's Medicare and Medicaid eligibility in real time at the start of the shopping process. There are several benefits of this tool for agents. Agents can verify the information entered is correct per CMS and confirm eligibility for Medicare and/or Medicaid before submitting an enrollment. This reduces the likelihood of beneficiary fallout in the event of misentered information or mistaken eligibility requirements. Verifying state Medicaid eligibility also helps to make the DSNP approval process quicker and easier. As we mentioned, but it bears repeating, ConnectureDRX has the largest carrier inventory in the Medicare industry and offers many Medicare supplement plan options in addition to all the other Medicare plan types. At your convenience, please visit the Connecture.com website and click on Company in our top header, and then Carrier Map. You'll see the number of plans in our carrier network for all plan types that we offer. You can click on MA, MedSup, prescription drug plans, and Ancillary. Hovering over the map will allow you to see the total number of carriers for each state, the number of plan types, as well as the market share for each plan type. This map is updated monthly. A new feature for AEP 2024, Multi-Year Plan View, is a simple toggle between the most recent plan year and the next plan year. There's no longer a need to open up new tabs or switch to a different site to view more than one plan year. Agents can shop and access enrollment history and quoting from one URL. Beautifully engaging, interactive, personalized videos are an option found on some Plan Compare One platforms. We offer 3 types of personalized videos: personalized quoting, scope of appointment, and consumer education. The quoting video addresses the beneficiary by name, communicates their provider network status, drug costs, and overall plan costs. Scope of appointment video also addresses the member by name and gives an overview of what a scope of appointment is and why it is a critical part of the quoting process. This helps to boost completion rates. Plus, it reduces calls and questions back to the agent about the scope of appointment process. The consumer education video includes an overview of the Medicare plan types available on that specific site. It explains how deductibles, coinsurance, copays, and out-of-pocket maximums determine the cost of in-network healthcare services. It also directs members to where they can input their preferences for more personalized experience.
Plansmart Analytics provides reporting that shows who may be impacted by plan changes. Plansmart is a highly targeted consumer impact analysis with demographics, plan benefit, pricing, and medicine cabinet data that helps you direct consumers to the best fit plan. This data and reporting helps avoid plan switching and disenrollment down the road. Provider search has been optimized this year to include, among others, visual search capabilities through maps, general practice filters, callouts for specialists, and the ability to search on value-based providers and facilities. Quick Quote has been around a while, but we wanted to call out some unique attributes of this feature. agents can select up to 3 plans to send to a beneficiary along with a personal note. What is unique is that the beneficiary can then add or edit their own preferences like health status, prescriptions, pharmacy, providers, and low-income subsidy when a quick quote is sent. And remember, agents get credit for the sale when sending a quote to a beneficiary that ends up in a completed enrollment. With our Scope of Appointment feature, you can complete, add, or upload scopes. Scopes of appointment are stored online for easy retrieval, even if an enrollment does not take place. This is another feature that has been around a while and has also been optimized for AEP. The shopping link is your personalized URL. This year, we have enhanced this feature so your URL does not change from year to year. You no longer need to update your marketing materials to change the URL with the new plan year. With your shopping link, you can drive beneficiaries to your website to self-serve, shop, compare plans, and enroll. You can add your link to your social media and your email signature. You'll receive a confirmation for every enrollment, and you'll be credited for each enrollment that results off of your personalized URL. In addition, your book of business will automatically update whenever a member enrolls for using your Pearl. One option that comes with Plan Compare One is the ability for an agent to complete the majority of an enrollment application and then text or email the enrollment to the beneficiary to review and sign on their device. This helps ensure accuracy and boost completion rates of applications on the platform.
ConnectureDRX has many years of experience with drug pricing and has built an extensive therapeutic drug alternatives database. We know how important accurate drug pricing is to ensuring the most reliable out-of-pocket annual costs. We also know the drug costs are one of the reasons why zero premium plans don't mean zero cost to the beneficiary. What's great about our therapeutic alternatives feature is you can find not only generic drugs, but brand-to-brand drugs in real time while shopping. Some of our competitors merely link out to a PDF to provide this information, and you're not getting the full exposure to current costs in real time. In addition, when beneficiaries have cost-effective alternatives, they are more likely to adhere to prescribed medication regimes, not skip doses to save money, and more. Medication adherence leads to better health outcomes. This is a fan favorite, one of the digital tools that makes an agent's life easier. Our total cost estimates are broken out in a lot of detail. For example, when you see a total cost estimate for health status plus drug, you're able to also see the costs broken down even further, including drug phase, pharmacy, effective date, month, and more. This detailed breakdown helps members visualize costs, choose the best fit plan for them, and plan for their medication expenses throughout the year. Preferences are typically added early in the shopping process so everyone can see the personalized plan options at the outset of the shopping experience. Preferences include health status, providers, prescription, pharmacy, and low-income subsidy status. As mentioned earlier, beneficiaries can update their preferences when they receive a quote from the agent. Prescriptions can automatically be uploaded from the Medicare Blue button to save time and help ensure accuracy. You can add multiple pharmacies, both retail and digital, to compare prices. You do not need to select a mail order pharmacy. Plan Compare One automatically does that to provide mail order pricing as well. Targeted messaging appears when dual eligibility is noted, so make sure you use preferences to provide a highly personalized customer experience, get to the best fit plan options sooner, and avoid potential unnecessary plan switching down the road.
We are so excited to have added value-based care providers to the largest distribution network in the Medicare industry. Now agents can deliver a more powerful member experience that can lead to lifelong member retention by engaging beneficiaries post-enrollment on our platform. Based on our partnerships with value-based care providers, members will have access to post-enrollment activities that may include opportunities like learning about value-based care, taking a virtual facility tour, and even scheduling an initial appointment with a primary care physician. Post-enrollment engagement is key during that pre-effective period before benefits begin. At ConnectureDRX, we provide multiple opportunities to keep the communication going between agents and beneficiaries. Offering value-based care providers on our platform is really a new channel to connect providers to agents and their members. Each of ConnectureDRX's value-based care partners has a unique patient-centered focus and approach to improving care delivery. Our partners include CenterWell, ChenMed, InnovaCare, and One Medical. ConnectureDRX's new technology channel offers value-based care providers new opportunities to deliver the right care at the right time. In forging new connections between providers, insurance agents, and their members, value-based care provider organizations will be able to drive better patient outcomes, reduce costs by focusing on prevention, and empower members to proactively improve their own health.
This is one of our exciting new features for this upcoming AEP. Now agents can collect a voice signature feature for both scope of appointment and enrollment when working with beneficiaries via phone. Just start recording on your recording solution of choice, select voice signature on our platform, read the script, and save the audio. It's that easy. As always, ConnectureDRX is committed to taking a proactive approach for CMS guidelines and regulations. As part of that effort, here are a few of the updates we've made to Plan Compare One and Plan Compare Edge that support the 2024 CMS guidelines. The number of Medicare organizations and plans that an agent is licensed to sell is now displayed on the member profile page and the plan list page. The agent can share this information with their clients within the first minute of their sales call. This is zip code dependent and only applies to MA, MAPD, and PDP plan types. We have updated the language on the scope of appointment page, reminding agents of the 48-hour requirement, and there is a section within the scope of appointment allowing agents to explain if and why they did not complete a scope 48 hours in advance.
Thank you for your time today. We covered a lot of things very quickly, but wanted to make sure to let you know about the exciting new features for this upcoming AEP and remind you about some tried and true digital tools we have optimized as they're important to a great customer experience. We welcome your questions and comments here or email us at marketing@connecture.com. We look forward to working with you this AEP and seeing you on a future webinar.